Health Watch. According to the CDC, there are still hundreds of COVID-related deaths in the country each week. That's not nothing, but it's a big country. And when you look at overall deaths in the U.S. from all causes, those are back down to pre-pandemic levels, which suggests we've reached an important milestone regarding COVID's full impact.
It is important because, number one, it tells us where we are with COVID. And number two, the all-cause mortality and the interplay of COVID and these other variables, I think it's very important.
And that's why we're going to look at COVID through that wider lens of deaths from all causes, because it fully encompasses not just deaths strictly from COVID, but also the indirect ones where COVID was just one of many factors, and even ripple effect deaths, like, say, people who ignored a heart attack because they were scared to go to a hospital because of COVID. They're all accounted for in this chart behind me. I want to start by showing you the orange line here, this wave. That's the expected number of deaths in the United States each week. The blue line is the actual number. As an aside, isn't it kind of interesting how cyclical it is? We get about 60,000 deaths a week during the height of winter, but only 50,000 during the height of summer. Also interesting, for people who said, COVID's nothing more than the flu. See this spike here in 2018? That was from the worst flu season in over a decade. Now look how tiny it was compared to what COVID did. I want to zoom in on this same graph for a second and show you that in a little more detail, because as both the Delta and the Omicron waves here and here, as they came and went, those death numbers briefly dipped down to normal before eventually jumping up again. This time around over here, it appears to be sticking. Those numbers appear to be staying low as COVID continues evolving into a milder threat. Now, Dr. Ulysses Wu, you just heard from him. He's from Hartford Healthcare. He said this is good news, but it's also no guarantee.
We certainly don't want to live fearful with our lives, but we do have to worry, especially this coming respiratory season, that it's going to come again.
And early indicators are showing that COVID cases might be rising again. But if true, at this point, it's only showing a very small rise.